we can do some interesting experiments with mTOR because there's this drug that's a very specific drug that targets mTOR that will turn mTOR off into this healthier repair state, this autophagy state. And so you might think, well, if mTOR is so fundamental in aging and longevity, what evidence do you have for it working in anything at all? So there's some interesting experiments. If you look at, let's say, aging, the phenotypes of aging, right? I'm a poster for it, right? Wrinkles, gray hair, receding hair, periodontal disease, hearing loss. All these things are phenotypes of aging. We all recognize them. So the drug that is available is called Rapamycin. It was discovered on Rapa Nui in the soil from a bacteria in the 1960s. And because of its discovery, they needed to understand what rapamycin worked on, and they found out this molecule. They named it TOR, which is, for lack of a better name, target of rapamycin. We could do some simple experiments. Well, in mice in the mouse model for hair loss and gray hair with aging, you give rapamycin to these mice and the hair starts to grow back and the coloration returns. It's less gray than before. What about wrinkles? In humans, in a prospective trial, rubbing rapamycin on a double-blinded prospective rapamycin cream on the skin once a day for 6 months, these humans then underwent punch biopsies of both hands, and the rapamycin treated hand showed return of the collagen basal layers, and they were visibly younger looking skin with the rapamycin being applied to that. And interestingly, the FDA has just approved rapamycin cream about 12 months ago, not for aging or wrinkles, but for other cancer type diseases. But it's now being used off label for that. But the list goes on and on. You apply rapamycin to animals with hearing loss, with age-related hearing loss, and the hair cells regrow in the cochlea, and some of the hearing improves. You add rapamycin to there's one disease of aging that most people don't think of as a disease of aging, but it affects 50% of our population 100% of the time if they live long enough, and that, of course, is ovarian failure or menopause. So if this miracle mTOR affects something fundamental about aging and longevity, it should affect menopause too. So when they give rapamycin to the rats or mice, to the mouse model, it increases their litter size. They become more fertile, and they have a longer fertile window. In other words, it delays menopause. So for all these applications, there are now human trials in place for, I quoted a lot of animal studies, but they're beginning to look at humans things. So this is fascinating. I mean, these things all have different mechanisms if you think about it for aging, but rapamycin somehow gets to a basic root cause. But you may say, well, wait a minute. Nobody dies of baldness. Nobody dies of menopause. Nobody dies of gray hair. This doesn't really affect longevity. It sure may make us look younger, may make our skin better. But what happens if mTOR is so fundamental to our longevity? What happens when we apply mTOR to these diseases of aging that actually kill us? Like I said, it's a short list. Number one is cardiovascular disease, heart attacks and strokes. Number two is cancer. Number three is Alzheimer's. Okay, what happens with mTOR when we turn it down in those? Well, actually, we talked about stents before, the mechanical things that are put in blood vessels. When most people get heart attacks now, they get these stents. The problem with the stents, as we alluded to, is the disease continues and the other blood vessels continue to clot down, and the stents actually reclot off with atheromas over time. So what does turning down mTOR do? Well, actually, there's now an FDA-approved indication. If you coat the stents with rapamycin, you dramatically slow or even stop the atherosclerosis from occurring. So it's FDA approved to stop atherosclerosis. And there are studies underway where now taking oral rapamycin may slow down atherosclerotic disease in all of us. Okay, that's okay, great. It works for that. What about cancer? Cancer is a completely different disease, completely different organ, different organization, different mechanism. Actually, if you let's look at a human model for cancer. Is transplants. You know what the most common cause of death? I didn't know this, but when I first started looking at this, the most common cause of death in a transplant patient, let's say heart transplants, within the first 5 years of getting a new transplant is?
No, I don't know.
I thought it was organ rejection or something, because that's what you're worried about when you transplant something in.
You'd think,
you give immunosuppressive drugs. It's actually cancer, because the immunosuppressive drugs lower the immune system and people get higher rates of cancer. So
makes sense now that you say it.
Yeah. As it turns out, rapamycin, in fact, its first FDA approved indication is for helping with organ rejection. So there's a large population of patients who routinely get rapamycin for organ rejection. And then there's another group also who have transplants who may get something else that also works, but just isn't rapamycin. So, but what they found in this study was that in this population, whose human population is predisposed to getting huge amounts of cancer, when they're given rapamycin, the cancer rates drop by 50%. And now to the point where there are at least 8 FDA-approved indications for rapamycin for treatment for cancer, things like metastatic renal cell cancer, which is the most common type of kidney cancer, and other types as well. So it's like, whoa, something's going on here at a fundamental level. The last one is Alzheimer's disease, right? What evidence do we have that mTOR is involved in Alzheimer's disease? Well, there's an animal model for Alzheimer's disease that in the mouse, it's called the Mouseheimer model, where they actually get cognitive impairment. They forget their keys, whatever the mouse equivalent is, and they have progressive dementia and everything. So when these mice are given rapamycin versus placebo, it actually reverses their mental fog, and their mental acuity returns back towards normal, to the point now the University of Texas is having a trial go underway with rapamycin as a treatment for Alzheimer's disease. It's a multi-million-dollar study that's underway. But if you think about it, we talked about ketogenic therapies and all. Ketosis is really a way of turning that mTOR switch back to the repair mode, because the nutrients it senses is glucose. And when you're in ketosis or on a ketogenic diet, your body is burning, butyrate and ketones type substances rather than glucose. So your glucose levels are very low, and your mTOR tends to turn back like that. But it's amazing. mTOR seems to play a role in these chronic diseases. And then, the last question is, well, is there any evidence that, fine, you can reverse the appearances of aging? You could reverse or slow the chronic diseases that determine my and your longevity. Is there any evidence to show giving rapamycin improves longevity itself, in humans? And the answer is there's no direct evidence, because it's very hard to do longevity studies in humans. Humans live 70 years, very soon 100 years, and but the point is, it's hard to do longevity studies. But there's a gold standard longevity study that you may have talked about with your audience before, that's run by the federal government. They use mice. It's called the Interventions Testing Program, or the ITP. And mice are great because they only live 3 years. So you can do a longevity study and know the results in 3 years. And the great thing about this longevity study, the ITP, is you and I as citizens can write in and suggest drugs to test. And what they do is they just take these mice they're not lab mice, they're actually wild type mice with genetically diverse appearance. They're in 3 different labs around the country, so it's not even one lab. And then they give them, half the mice just get raised normally, they live their lives and die. The other half get whatever the intervention is, typically the drug, the substance. And then at the end, they look at the lifespan of the mice. And is there a difference between the intervention and the regular mice? And, is there an improvement? Is there a longevity effect? And because we get to suggest everything, this has been around for 20 years. There have been some amazing thing tests that green tea, curcumin, NAD supplements, CoQ10, statins, all kinds of stuff that, that people wonder about for longevity. And the interesting thing is most of these had no effect. And there are only a handful of things that have an effect. And by far, the most powerful, most significant effect that knocks it out of the park is rapamycin. And one last nuance to it, when they did the rapamycin study, typically they give the drugs for the whole life of the mouse, which is not really realistic for you and I because, we're older and we don't get a chance to start it from birth anymore. And we may not want to, we don't know that that's a good idea. But for for the rapamycin trial, they messed up on making the food, and they wound up they couldn't get the supplements right. So the mice didn't start the rapamycin until they were the equivalent of 60 to 70 years old in human years, and even starting at that late age, they saw this dramatic longevity benefit.
Wow. So we've talked about a ton of positives. Any negatives?
Yeah, well, rapamycin, one thing, just to be clear, the very first use of rapamycin and the groundbreaking use for which it got FDA approval in 1999 was for immune suppression for renal cell transplants and other organ transplants. So immune suppression is a good thing if you have a transplanted organ from a foreign donor in your body. It's kind of a bad thing for you and I, to suppress your immune system, because immune system is important for all sorts of things. And most doctors, if you go to your private doctor and say, hey, I'm thinking about taking rapamycin for longevity, they'll go, whoa, no, you don't want to take that. That's an immunosuppressant. And so there's a lot of misunderstanding about rapamycin. To be clear, when humans take rapamycin, and it's FDA approved for a number of indications, but it's not approved for longevity, just because longevity is not an FDA indication, or it's not considered a disease or aging. When people take rapamycin for longevity, they typically do it instead of the daily dose, which is the renal transplant immune suppression dose, they do it once a week. And that once a week, the half-life of rapamycin is short enough, 48 hours, that it's gone in a couple days, or at least significantly decreased. So there's that misunderstanding about rapamycin. So there's a lot of uncertainty with physicians. But what about safety profile? That's a key point. Rapamycin is actually very safe drug. There aren't a lot of contraindications for it. There's a report in the literature, someone tried to commit suicide with rapamycin with over 10 times the recommended dose in one shot. They went into the ER and basically nothing happened. So the toxicity profile is very good. The side effects of rapamycin are the one thing some people note are mouth ulcers, little like cold sores or aphthous ulcers. A small percentage of patients get these. They're reversible. They go away, and they usually stop. But other than that, the biggest thing about rapamycin is we really don't understand it. We're just at the beginning of all these things, and it's a little bit of the Wild West. Even the dosage that people take, it's almost arbitrary. The dosage that we take. There's not a lot of data. It's still coming in. So it's kind of a leap of faith to, to take these drugs. I think the message that I try and communicate, and I certainly practice it myself, is that rapamycin's powerful. It's, it does work on mTOR, but something even more powerful is our lifestyle. And I would never take rapamycin before I did all the lifestyle stuff first, because why is that? Rapamycin works, right? The ITP, done deal. Why not just take it? Well, some interesting results came out in the last literally 24 months. The ITP took another drug called acarbose, which has a small lifespan benefit. And when they combined, there's another drug called metformin, which people also take for longevity. Metformin had no effect on the ITP. That doesn't mean it doesn't work at all for longevity. Nobody knows, but at the dose it was given, if something fails the ITP, it just means that dose, it didn't work. It's like if you take an antibiotic, if you take too low a dose, it won't work, but that doesn't mean it doesn't work theoretically. So metformin failed the ITP, but when they combined metformin with rapamycin, they got an even greater effect than rapamycin alone. So there's some synergy with, AMP kinase that metformin affects with rapamycin. But my point was, about 12 months ago, they published a paper where they combined acarbose with rapamycin. Acarbose has a small benefit in the ITP. Rapamycin has a huge benefit. When they combined the two of them, they got a greater benefit than either one of them separately. So there's some kind of synergy that we just don't understand. So rapamycin may be a great idea for longevity, but if you want to cover your bets, I would do longevity. I fix my diet, my sleep, my exercise, stress, all those other things as well, because otherwise you're leaving a lot on the table and you can miss out. And rapamycin or whatever longevity stack you use will likely be potentiated by your lifestyle.
And when it comes to rapamycin, is it totally downregulating mTOR? How much of an effect does it have? Because we know mTOR, again, isn't bad or good. It's just regulating how often it's activated. So what kind of effect does the drug have on mTOR specifically?
Yeah, that's a great question. Unfortunately, nobody knows. We don't have they're not good molecular markers in a clinical sense for mTOR. If I do NAD supplementation, for example, I could check, with, if I do NMN or, NMR, I could check my NAD levels. With mTOR, there aren't easy clinically accessible indicators of that. We know from the science that it's affecting mTOR and these downstream effects, but there aren't easy indicators. So when I take my daily dose of mTOR, or my daily dose or my weekly dose of rapamycin, people say, "Well, how do you feel?" I say, "I feel great, but I'm also fasting. I'm, exercise. I'm doing all sorts of other things. So it's hard to tell what the actual effect is. And it's not like I stop it and I feel bad, or I take too much and I get side effects. It's really a black box. And that's the challenge with this particular longevity drug. It's both good and bad, but it's something that we'd like to, hopefully in the future we'll know much more about it and get better indicators that we can follow that it's working, and figure out even what the right dose is,
So you're taking it on a weekly basis. How long have you been doing that for?
I think I'm going on 3 years now.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
If I put food into my mouth and it goes into my stomach and my GI tract, no matter what the food is, it's going to drive inflammation, because inflammation is the body's natural protection against foreign material. Fructose, when it's metabolized